Hello, today is November 25th, 2024, and I wanted to give everybody an update about my experience in going through the company called Frontline Health Advocates. On their web page, it says our mission statement is the core mission of Frontline Health Advocates as the leading provider of medical legal exemptions is to protect the current and future health of our patients together with our medical legal partners by empowering and protecting our patients' right to medical choice and freedom. So I, like everybody else, was very leery of this whole process. It doesn't seem like you can find a whole lot online about it, pros and cons. But if you Google it, it does consider it a scam. But then again, I don't trust a lot about what Google has to say anymore because everything is now geared towards the official narrative. So it's hard to find the truth anymore online because everything's being scrubbed and cleaned and scrutinized. Anything with the truth is pretty much taken out. Well, anyway, as most of you know, my name is Cassandra Sue Willock, and I'm a nurse, registered nurse. I'm currently working at a state psychiatric hospital that is owned by the state, funded by the state, and they denied my religious exemption for the flu shot. Even though they have a policy that allows religious exemptions, even though it's in state law that you can have a religious exemption and that it's in the United States Constitution and the First Amendment, freedom of religious freedom, they still are above the law and above their own policy, and they denied me my sincere religious beliefs of not wanting to inject anything, including the flu shot. They said that they would take the religious exemption for the COVID shot, but not the flu shot. Why? I know why. It's because they want federal funding. And they even told me in one email, as I've been going back and forth and back and forth and back and forth up the chain, all the way to my state representative, who is useless. Representative Miss Luck, you're useless. Because they all support their requirement of having a 90% compliance rate with staff getting the flu shot. And I've heard about this 90% before with schools, hospitals. They get more federal funding when they reach that 90% mark. So it's about money. And has nothing to do with your rights or protecting a high-risk population of your patients from you because you're a walking dirt bag of virus if you don't get the flu shot. It's about federal funding. And heck with your rights. So this is what we're dealing with. We're dealing with agencies and companies and hospitals, schools that feel like they're above the law. And they just deny you. And in my experience, I tried to do the right thing as always. I went up the chain of command saying, why is this denied? Did anybody even read my sincere religious belief? Is there any way I can counter your denial? Who can I go to? I went up to EEOC for the state. I went to my state representative. I've contacted 4 attorneys in the state here, and not one of them is interested in it. So this is what people are dealing with. Where are you supposed to go to get your rights upheld? So I contacted, again, Frontline Health Advocates. You can search them online to see what their scoop was. So I called, made an appointment. I had an initial appointment with a gal named Lisa. She was a very professional. I had a good feeling talking to her initially. So she pretty much screens you and gives you some information. She sends you a link to watch a video on how their process works. It costs, the process costs $500. And if you want it expedited, that's an extra $200. But the whole process from beginning to end takes less than 10 days. So again, my initial phone call was about 15 minutes with a gal named Lisa. She gave me basic information, sent me a link. She also sent me an intake form, like a doctor's office would give you initial paperwork to ask you basic questions, allergies, your name, your address, your health questionnaire, basic health questionnaire. So I filled that out, and I was able to get an appointment with a follow-up assessment within a day or two. So tonight I had that assessment phone call. It was from an RN named Nicole, and she went through an extensive health history, family health history, and kind of explained their process and procedure a little bit more in detail. And so what you're getting here is not a medical exemption that some people are thinking. What you are getting is a medical legal waiver that is written under the guise of ADA laws. So you're going to get a document signed by a medical doctor. In my case, it's going to be Dr. Andrew. And apparently this Frontline health advocate is also ran by Dr. William Lionberg. And I asked her if these are the same Frontline doctors as we heard about in the news with COVID. You can't say it on Facebook. The same Frontline doctors during that mass hysteria event a few years ago. And she said yes. And so they have a legal team that also is going to type up a document for me stating in legal terms that me personally, due to the information that I gave RN Nicole, which is extensive, stating that I, under federal ADA laws and under this doctor's signed waiver, that I am never again to get anything in my upper arm ever again. And it's going to have very detailed legal words in it. So I see some of the people in this group, their waivers were denied in California. They're clinging to a small catch that it's not a medical exemption. This is a medical waiver. But one thing that was really brought to my attention by somebody very smart and handsome, he said you can take these documents to your doctor or any doctor and say, hey, I need you to fill out this medical exemption for me, and here is my medical waiver and documentation from an attorney that backs and supports my rights based on my personal medical history. And this would take all of the stress or intimidation from that particular MD or provider, because now providers are afraid to write medical exemptions because their license might be questioned or even taken, because you can't question and write medical exemptions because the narrative is they're all safe and effective, right? So if you have a medical doctor licensed by a state that's been writing a few or more medical exemptions, they're going to get flagged in the system. But that doctor can pull out your chart and say, hey, look at this documentation I have. It's signed by another doctor and an attorney to say, this is not good for her. She cannot have this. So I think that would cover that doctor a bit more. And that doctor might feel a little more comfortable writing that medical exemption for you if you have this. Sarah wrote a question on my Facebook page saying, "Do you know about any doctors in Canada willing to do this?" No, I don't. See, these are United States federal laws here, and I don't know how Canada works. So I'm sorry I can't help you, but the initial call is free. The initial call is free. My assessment that I had tonight with RN Nicole was free. I don't pay anything until I'm ready to purchase my documents. And everything's going to be sent to me via email to review. And if everything looks good, I will pay the $500. So, Sarah, I would suggest you call or go onto their website because it's free. And the two ladies that I spoke to up until this point, Lisa and Nicole, were extremely professional and extremely knowledgeable. They were very nice. They were open to questions. And believe me, I've been researching this topic for a decade, and I gave them some pretty tough questions, and they answered them I was pretty impressed. So call Frontline Health Advocates or go to their website, Frontline Health Advocates, and there's a contact button, and it says contact us with the form below. And somebody will get back with you within a day or two. So I didn't get my documents yet. I don't know what they look like. I'll give a follow-up video as soon as I do get them. Apparently, this paperwork is supposed to be all-encompassing. It's going to cover every future jab. I can't say it. Is this Nazi? Did I stumble into Nazi Germany? You know, these... No, that's not a gang symbol. Well, it could be, right? So the documents are supposed to protect me for a lifetime against any and all future these things. So there's no expiration date on it. And that's pretty much all I have so far. If anybody has any questions or comments, let me know, and I'll try to answer your questions. But I'm using this Facebook Live so that I can transfer it to the group that I'm in, an exemption group that's on Facebook. I might go ahead and post this on my other social media sites too, just so that people know what they're dealing with this Frontline group. And just sharing my experience, because it is a lot of money. I mean, I haven't worked much this last year, so $500 is it's a lot. It's a lot for anybody. I mean, most are in the same boat, right? So I will keep everybody posted, but that is what I know so far. All right. I'll talk to you soon.